Hello, thank you so much for joining us today for our COVID-19 Data Challenge Lightning Talk with Dr. Ashok Srinivasan. Dr. Srinivasan is the William Nystall Eminent Scholar Chair and Professor at the University of West Florida and a Fulbright Fellow. He obtained his PhD in computer science from UC Santa Barbara. He performed postdoc research at the University of Illinois Urbana-Champaign and subsequently held faculty positions at ITSB and Florida State. His research on applications of supercomputing has been funded by the National Science Foundation, the Department of Energy, Department of Defense, etc. He's currently leading the Project VIPRA, a multi-disciplinary project on the spread of infections through air travel. This research was identified as one of the major scientific breakthroughs using the flagship Blue Waters supercomputer at the National Center for Supercomputing Applications. Its results have been highlighted in over 200 news outlets around the world and cited in congressional testimony. His lightning talk today is titled COVID-19 in Crowded Locations, Leveraging New Data Sources to Analyze Risk. Dr. Srinivasan, welcome.
Thanks for the introduction. This is joint work with a few students and a bunch of collaborators. We started this work in the context of infection spread through air travel about 5 years back in the aftermath of the Ebola pandemic. Many of our techniques apply to any crowded location. So we have a funded project on dealing with other crowded locations for the COVID pandemic. What I'll do is I'll first give a motivation. Our main motivation is some challenges that arise in identifying policies that can increase social distance as humans move in a crowd. I'll discuss our modeling approach, and then I'll do two examples. One, a fine-scale analysis in queues at airports, which is more along the lines of our main research focus. I'll also do a core-scale analysis on public response to policies, which is something we do, but it's not our main focus. I'll then discuss the opportunities and challenges in such modeling. The proximity between humans is the main driver of COVID-19 risk, and this is similar in other diseases, for example, in Ebola, SARS, and so on. And social distancing is often attempted to decrease the risk of infection. However, the strategies that are usually used also disrupt human activities. So the question that we want to ask is, can fine-tuned changes to the built environment reduce infection risk more efficiently? That is, can you decrease the amount of disruption to human activities and at the same time maintain certain social distance? Looking at built environment is important because a lot of the COVID spread actually happens in indoor places. So we need to look at what is happening indoors to see if we can reduce the risk of infection. There are challenges of coming with prescriptions. In science, we often have descriptions, predictions, and so on. But if you want to come up with prescriptive solutions, we have some problems. One is that there's a lot of lack of data when you have a new infection outbreak. There's inherent uncertainty in human behavior. And there are also some mathematical constraints estimating model parameters. I'll give an example of the latter. We are looking at the number of COVID super spreading cases. And if we do a log-log plot of the survival function, then you can see that for a lot of decent distribution, tail distribution like Gaussian and so on, this curve will actually flatten out like this very quickly. But here is what is called the Pareto distribution. It goes off like this, which means that rare events are much more likely to happen than with thin tail distribution. A problem over here is that you have an exponent that is below 2, which means that the variance is infinite. So if you average the size of a few outbreaks to calculate the expected size, then you're likely to go actually underestimate what the actual infection risk is, because you usually need a huge number of samples to be able to estimate something with infinite variance. So if you have a model and you're trying to estimate some model parameters based on that, or if you want to validate your model, it's going to be very hard to do. So this is one of the challenges in coming with models that can actually do prediction. basic fundamental issue is that a lot of these models, especially in the context of infection spread in enclosed environments, are based on scientific understanding rather than on intervention. So if you look at a causal model, then the model may not capture real human behavior because you abstracted some behavior out. If you have predictive models, they usually depend on a lot of data, and you may not have enough data. Okay, so or the data may not be correct, and so on. You have a lot of problems with that. And so models, especially for example on flight, which is an indoor environment, have underestimated and overestimated infection risk. So it's very hard to say what is really going to happen. So another issue with is that the conventional models often have coarse granularity. For example, they may say based on so much traffic, this is the risk. But you need to account for demographic heterogeneity. You have to account for spatial and temporal resolution, which may not be adequate for the models. And the data for the models may not be timely either. So for example, if you're using some census data or something, it's going to be quite outdated. So prediction is very hard for many of these reasons. So what we do is we focus on vulnerability. It turns out that to make effective public health interventions, you don't really need to be able to predict. So what if you're able to say that this policy is typically better than that policy in avoiding a big disaster, right? Maybe you just want to avoid a disaster. That can be helpful. Or you may want to say this policy is consistently better than another policy. We don't know what the actual risk is, but maybe this is going to be twice as good as the other one. Maybe you can compare policies that way. So you can actually do a lot of useful stuff without actually doing prediction. So we kind of focus on vulnerability rather than coming up with exact prediction. Here's an example where I'll illustrate how we do things without using any data. So we'll just use a mathematical model, look at what we do, and then look at what are some of the challenges in modeling using only mathematical equations. So here's people boarding a flight. So we model how individual people move. Then we when they board a flight, and say, okay, we can see who's getting close to who, and based on that, we can actually find a contact pattern. We can say that there are a lot of human contacts in one boarding procedure and fewer boarding contacts in another boarding procedure. So based on that, we can, of course, humans behave in many different manners. So what we do is we generate a large number of scenarios for each boarding procedure. Humans may behave not in one particular manner, but many different manners. And so there's a distribution of what possible contacts you can actually have. So we compare different policies. So you can see that these are new policies that airlines introduced in response to CDC and Department of Transportation guidelines. And these new policies actually increase risk compared to what they had earlier. And we had published a better policy a few years back, and that actually is much better in reducing contact risk. Okay, so this is an example to show that how you use fine-grained model of human movement to identify risk. Not only to look at the movement pattern, but you also generate a wide variety of scenarios. And one policy is better than the other if it is consistently and very clearly different in outcomes from the other policies. I'll skip this slide. So here are some challenges. So that mathematical model looks okay when people are boarding flights, but we may need to identify discretionary human behavior. For example, if you look at an airport, then some people may go to a Wendy's outlet, some people may go to a Taco Bell outlet. What are people going to do? That model can't actually answer that question. There's a discretionary human behavior that we need to be able to figure out. The other is we need to identify locations at risk. Maybe we're looking at people boarding a plane, but maybe that's not where the risk is in an airport, right? So we need to look at where is the risk so that we can target it for modeling and intervention. And maybe the other issue is that maybe there are a lot of people present over in a particular place and they're mingling and having a lot of contact, but maybe no one is infective there, right? In which case no one will get sick. So you want to look at, be able to figure out, have they had prior exposure that they could be infected, right? You may, for example, also look at the future healthcare visits and say, oh yeah, they flew on this particular date and 1 week later they had themselves tested for COVID, which means they might have actually been sick when they were traveling. Right? Also, people may have, they may be sick and they may be mingling, but maybe they are wearing masks, which reduce infection likelihood. So you want to be able to identify many of these aspects. And of course, these models have parameters. You want to be able to estimate model parameters too. So new data sources can help us identify many of these factors. We use location-based services data from cell phone apps, which will describe soon, and we use network cameras to help identify some of these issues. Here's a basic mathematical model. Given the layout of the building and the procedures that you're going to carry out, we can actually see how people move. Based on how people move, we say who became close to whom, and we feed to an infection model that says, okay, this is the distribution of risk for infection outbreaks. Okay, so that is a basic mathematical model. Then we are going to add the location-based services data, which tells us where people are. So it may tell us, okay, if you're at an airport, maybe you have to look at security queues, maybe you have to look at boarding gates, or maybe you'll say, maybe you don't need to look at airports, maybe you need to look at restaurants, or maybe you need to look at colleges, right? So it tells us where the location are at high risk of crowds gathering over there. You may also be able to figure out the likelihood of infected people being present. For example, if there are a lot of people coming from a location which has a lot of COVID cases, then maybe there's a lot of risk of infection there, of the infection being brought in here. Or maybe if this person had COVID test done a couple of days back, maybe those people are likely to be sick. So there's a bigger risk of infection spread due to those people. Okay, so you can use location-based services data to figure that out. We also have a collaborator working on network cameras from around the world, where you can see how people are behaving. So that can actually give you some information that will help us model how people are moving. It will also tell us, for example, are a lot of people wearing masks in some location, right? Which is a behavioral aspect which impacts the risk of infection. So using these data sources, we can improve the model and make it more realistic and provide it information that it does not have. So here are two issues in dealing with data versus model. We include both model and data. The empirical data provides realistic information, but the conventional data may not be timely, like census, or new data sources like social media may be biased and noisy. Okay? Also, they observe only what is actually happening. If something has not happened, they may not actually observe it, and they may also miss rare events which happen very infrequently. Models, on the other hand, can give very fine-grained detail. They account for underlying mechanisms, but they may also miss complex interactions because you didn't account for it. Also, if you have a model developed for one context, it may not work if the context and culture are different, which impacts people's mobility patterns and mask behavior and so on. So in our model, we actually use a mathematical model for how people actually move. And then we parameter the source of uncertainty. Basically, what this does is it generates a large number of scenarios about how people can move. We don't know how exactly people move, but we know that there are many different ways they could move. So we model that aspect. And we use data to identify new behavioral features that a model misses, and also to estimate model parameters, so we get a more realistic idea of what is actually happening. So we combine both the model, a causal model, and data to accomplish this. We use location-based services data. The important thing is it covers a huge fraction of the US population. The accuracy is about 10 meters, and you have, you're getting a record. This means around once in 10 minutes or so, you actually have data on people. Now the security, so we look at an example with a fine scale analysis. We looked at Orlando Airport and figured out most of the people are around the security checkpoint. A few people are in the check-in desks and some people in food court. Most of it is the security checkpoint, right? So this is from LBS data. So this tells us that let us focus on the security queues and see what is happening in the security queue. Then we use a pedestrian dynamics model to move to figure out what is happening in the security queues as people move. You can have different types of layouts. You may have only one inlet, or you may have two inlets, and so on. And we've figured out that using a few changes, you can reduce the amount of social contact by around 75% in the airport. So this is an example of a fine-scale analysis. And you can also identify infection risk of people. For example, here what we did is we saw how many people went to a COVID testing center and then had flown from the Jacksonville airport 2 weeks earlier or flew 1 week later. Okay, so you can see around March and all that, you have a reasonable fraction of people who are actually flying who are probably could have been sick. It rapidly declined in April, but it seems to be slowly increasing, which shows that you may have increased risk of infection spread through air travel if this trend continues. Okay, so again, location-based services data helps you identify such trends. So now I look at some core scale analysis. Let me skip this slide. So here, what we are plotting is the number of contacts in crowded locations. We ignore uncrowded locations. This is in Florida. And you can see that the Florida lockdown started in April. But much of the decrease in social contacts actually happened after school closing and restaurant closure at big time. So by the time the lockdown actually happened, social contacts actually already bottomed out. And in fact, after lockdown started, social contacts are slowly increasing. Okay, and if you look at the reopening, Florida reopening, there's just an increasing trend that is continuing. Nothing really great is actually happening. It's not the reopening itself dramatically increased social contact. People already started increasing social contact even before that. Okay. And so it looks like human response appears to be more important than government policies, at least in Florida. We looked at some really rural areas in North Florida. These are kind of very close to Alabama border and so on. And one interesting thing is you see not only people did decrease the amount of distance they travel. There are other results to show they also decrease the time spent outdoors and so on. Okay, but if you look at what really happened, where are they going when they actually do travel? One interesting thing that observation is that the number of contacts in restaurants are actually increased, though in some other places it decreased, which is very curious because the restaurants are actually officially closed for indoor service at the time. But these are again, some really rural counties, and so a few places could actually make a big impact. But the interesting thing is that we need to understand what people are doing, especially in places that are not that very well covered, in some rural areas, for instance. I just had a graph about San Diego's trend because a lot of you may be in California. So one thing you see over there is the social distancing remained at a low level for a very long time. It does increase a little bit in this region, but it's not as much as in Florida, and then it kind of decreases again. So it looks like on the whole in California, you have much social distancing has kind of been observed much more effectively than in Florida. And there are other data sources, from Safegraph, that actually show what where the drop-off comes from. And I'll just discuss a little bit about the opportunities and challenges. Fine-scale and timely data for large number of users are available. These are the opportunities, and they can help you with your models. But the data can be noisy and biased. Okay, for example, our data does not include children, so that is a big bias, right? Conventional data may be able to remove some of the bias, but if you did not, by reweighting, but if you did not include them in the first place, then you won't capture them. You can use other data sources. For example, in other work, we have included Twitter data and so on. The other is data cleansing is very important because there is a lot of erroneous data also in these huge data feeds. Like the data set we use around over 50 terabytes, so processing it is of course hard, but then you have to look at the errors in those huge data sets too. And there are privacy restrictions that limit data availability. For example, we are not allowed to track people in schools or children and so on, which limits what we can do with any single data source. So you can go to our webpage if you want to get more information. So if you have any questions, then I'll be happy to answer those.
Dr. Srinivasan, thank you so much. We are running a little late, so I think we unfortunately don't have time for any questions right now. But if anybody has questions, you most likely have either Melissa's or my emails, definitely Melissa's, and send her an email and she can connect you with Dr. Srinivasan. Thank you so much. And really appreciate you participating in our COVID-19 data challenge with this great lightning talk. Thank you.
Yeah, bye.
Bye-bye.